That is okay. So now I've got to click got it. Very American. Okay, so disclaimers. When I use the term woman, I mean anyone that was born with ovaries. I struggle with pronouns, even though I've got a non-binary offspring. So I'm sorry if I upset anybody. I mean anyone with ovaries, whatever, however you identify. And also nobody from any company pays me, although I will mention a number of products. None of them are paying me. Okay, so what is normal? In order to know what is normal, we've actually got to have a look, haven't we? And it's not only about looking, it's about feeling. Now, unless you're an extremely bendy yoga person, it's not very easy to look at your vulva. So big mirrors are handy. If you really want to, if your vision is awful like mine, those makeup mirrors that are magnifying ones are really handy. So you can have a little look and see what's going on. Get used to what everything looks like. Some people, you can use your phone. If you're taking a screenshot, remember to delete it in case it gets shared anywhere. And also feeling is really important, because when we're noticing changes, it's not only what the tissue looks like, it's the consistency of the tissues that matter. Okay, so really, yeah, have a look, have a feel. So, and this is my slide that Meera, anyone that's been to any of my talks has seen this slide, because this is all the taboo stuff. There's loads of vulval art around now, which I think is really cool. The one on the left was at a craft show in the Birmingham NEC. It was hidden around the back of a stand, but it was there. The crochet bits, as Zoe Hodson has crocheted these vulvas, and she's just a living legend. The next one is a rug that's been made, and the one on the right is the one that really makes me laugh. It's a football stadium from Qatar, and I don't know if someone did it sneakily or if they didn't realise. So all of this sort of thing, it's about being kind of jokey and a bit quirky about it, but just I have to force myself as well to be comfortable talking about vaginas, vulvas, being open about it. And I think the more we can get this out in this sort of art or imagery, the easier it gets. So how are things arranged inside? I photographed this out of an anatomy textbook that I used when I started medical school in 1982. So this is very ancient. This is out of Snell's Anatomy. So I don't know if you can see the cursor, Meera, but at the front here is your bladder. Can you see my cursor? So that's where your bladder sits. And in us, in girls, the tube that goes from the bladder to the outside world is really short. So our continence, our ability not to pee all the while, depends on this little bit here. There's a little sphincter there, and it's the angle that our bladder sits at. So behind here, this next thing is our womb and our vagina, okay? Then there's some tissue behind, and then that's the rectum. So if any of you have had children, vaginal deliveries, you will have put pressure, as I did, on my vagina, on the wall. The only things holding it up are these ligaments here. So you can get a little bit of bulging and weakness of this wall. If you get bulging and weakness of the front wall, it means that the angle of the bladder, we've shot on to the next one, sorry. The angle of the bladder changes, so our continence may not be as good. If we get some bulging at the back of our vaginal wall, the front of it's called a urethra seal. If we get bulging at the front of the vagina that affects the bladder function, we can also get bulging at the back, which then affects how we empty our bowels. So what can happen, I've lost my cursor, is we get a little bulging of the vagina here. So if we're straining, trying to have a poo, sorry, I hope no one's eating, the poo gets stuck in the little pouch. So there's gadgets you can use to flatten it all out. So, but when you see this, you can see why it might all be a problem. So obviously we can't actually see this ourselves, but knowing where all the bits are, I think is really useful. So this is bladder, urethra, which is the tube that comes to the outside, vagina, uterus, and large bowel and rectum at the back. So when we're looking at ourselves underneath, this whole thing is the vulva. Up here is the hair-bearing bit, or should be a hair-bearing bit, called the mons pubis, which is a fatty pad and tissue at the top. Then we've got here, this is our vagina. It's the opening, it's the bit, yeah, I think everybody probably knows what the vagina is. The vaginal tissue is a very stretchy tissue. It's like concertinaed so that it can expand easily, so that we can give birth, so that we can have sex. So when we're well estrogenized in the younger part of our life, it's a really stretchy tissue. Then the bladder opens out just above this. So you can see how close the bladder opening is to the vagina. Up above this at the top, we've got the clitoral head. This is not the whole clitoris, so this is where the golden vulva comes to play. Okay, clitoral head is up here. But the clitoris is a huge nerve. Oh, can you see that? So it's like a wishbone. So the other arms of this nerve come down either side of the labia, which are the inner small lips here. So that's your clitoral head. Clitoral nerve tissue comes down either side here. Okay. Then we've got, so that's the labia minora, the little lips, the inner lips, and then we've got the outer lips, which are called the labia majora, and they're hair-bearing on the outside. Okay, so now we hopefully know where everything is. This model I've got it's gold for a reason, because there was no color that I could find that would fit every woman, because we're all different ethnic origins, so we're all different. So this is a very stylized, different. Nobody looks like this. And the other way in which nobody looks like this is nobody is this symmetrical and neat. It is normal to have one labia that's bigger than another. You don't need surgery to even it up. Surgery just messes with the reasonable function. We leave it alone. It doesn't have, most people's labias are actually much bigger than are shown on this model and in most diagrams that I've seen. So it's normal to be asymmetrical. It's normal for labia to be bigger. They're not all neat and, perfectly stylized like some sort of, I don't know, magazine representation. So we're all different. We don't need messing with. What you can see here as well is that everything is very close together. So the fashion now, we have to de-hair everything, don't we? So if we're de-hairing around the mons, around the labia, all of this, it's really easy to then irritate the delicate labial tissue inside. So the depilatory creams, using razors, wax, all of this is really irritating to this delicate tissue. So even premenopausally, we should be very careful about this. And most certainly perimenopausally and menopausally, this tissue is already struggling. So we don't want to be battering it with all sorts of irritants. So get to know what you look like, get to know what you feel like. When we're menstruating, when we've got our hormones going up and down and the normal cycle, all of this tissue is well estrogenized. There's little bits of fat in the labia, around the mons. It's all there to protect the important bits. As we start to lose our estrogen, we lose that fat, we lose collagen and elastin, and it all gets a little bit less stretchy and a little bit flatter. Okay, so these are the normal process changes with age. When we're looking at ourselves, we might see a number of changes, but it's a bit like checking your own boobs for lumps. We have to get used to what we feel like normally to know when there's a change. What's normal for us may not be normal for someone else. So there's a variety of changes that we might notice. Actually, I won't talk about that. I'll go to the different slides, sorry. So what changes might we notice? We might notice that we've got discomfort, either that's just there when we're not touching. So when we're just standing, we suddenly become aware of our vulva, which is not normal. We don't normally. Or it might be tender when touched. If we're riding a bicycle or wearing tight clothing, we might feel that everything's gone a bit drier. We might notice redness. We might notice loss of definition of the tissue, which means that the labia that were very obvious before are becoming a little bit smaller. We might notice that we have a discharge. We might notice that there are little lumps around. They might look like little cauliflowers sometimes. We might notice a change in odor. We might notice small breaks in tissue, itchiness, clitoral sensitivity or desensitivity. Red flag things, the reason that I've put these in bold is thickening of the tissue, which is why I say to feel, can occur, and it's independent of hormone status. And there's two conditions called lichen planus and lichen sclerosus etetrophicus, which are ridiculous Latin terms, but it's basically a change in the tissue where the tissue becomes thicker, it becomes white, and you can get red broken areas. This is important to recognize, to take to your doctor, because it may develop into a precancerous condition. So if we know what we normally look like and feel like, if something's gone a bit like thicker and rubbery and it's gone very pale, we know to get it checked out. That's really important. Any ulcers or sore areas also need to be checked out. Again, they can be part of this lichen sclerosus thing. Or there's other causes of ulcers. Now, not uncommon. The world has changed, hasn't it? 40-year-old women, lots of 40-year-old women are out there on the online dating. So I don't know about your kids. My kids are fantastic at taking themselves off, getting lots of sexual health screening. My generation, we never went. It was embarrassing. You didn't go to the clinic, did you? You sort of put a bag on your head, you wouldn't get tested. So our age group don't, but we've got the whole internet dating thing going on. We're not so good at insisting everyone wears condoms, all that sort of thing. So if we get little blisters, we need to think herpes, really important, because herpes is an easily dealt with problem. It's not a disease of dirty people, of promiscuous people. It's just a cold sore virus that happens to have affected your vulval area, and it can be transmitted on fingers, from mouths, or from genital contact. So if you've got little blisters, if it feels sore and there's a discharge and you perhaps feel a bit fluey, get yourself off to your GP, your practice nurse, or a sexual health clinic, and they can swab, and then you can have appropriate treatment and deal with it. You might notice if you get little cauliflower type things, that can mean, again, warts down there, again, easily dealt with, just need to take it to the right place. Other discharges we might notice, I think most of us, well, I don't know, you may or may not recognize a thrush type discharge, which is always described as cottage cheese, little white deposits. Now, postmenopausal women who have no estrogen around do not get thrush. So most pharmacists will not sell Canesten cream and the like to a woman who has stopped having her periods, because if they've got a discharge, it may be a sign of something else and they need to seek advice. There is a small group of women who use vaginal estrogens to treat genitourinary syndrome of the menopause, who then get thrush as a result. It's a small subsection, but that one does happen. So that's sort of it's a bit of a quick run through of the sort of things we're looking for, but basically we're looking for changes, okay? And the sort of changes that we notice with hormone reduction and fluctuation is dryness, sensitivity, loss of definition of our labia, of the lips. We're also likely or may well get some problems with our bladder control. Because everything's very close, we're very reliant on a healthy vulval tissue to stop bugs being able to get into our bladder and to stop the urethral opening. So the opening of the bladder, if the tissue is very dry and it's irritating, when it gets irritated, your bladder thinks, oh, that means I need to contract. So you find that you're running to the toilet. When you get there, you're not peeing so much. So you've got urinary frequency. Your continence isn't as good because also the stabilizing bit of the bladder muscle needs estrogen. So we've got all of these different symptoms that can go along with that. And again, we can get overgrowth of the clitoral hood, which means that our clitoris is less sensitive, which matters, doesn't it? Okay, whether we're stimulating it on our own or with a partner. So another thing we need to know about that I'll just throw in here is because the clitoris goes down both of the labia at the side, stimulation around the labia can be an alternative to clitoral stimulation, particularly if we've got a little bit of swelling around the clitoral head from lack of estrogen. Right. So I'm going to quickly go back to how we should be looking after ourselves. So, you know, our vulva's sensitive and it's precious and it does lots of good things for us. So we've got to look after it. We don't need anything scented around there, okay? We do not need vaginal deodorants or odorizers. It's absolutely anything like that has got an additive in, it's going to irritate. Please don't use it. Ban the bomb. We're all going to ban the bomb. Bath bombs are Satan's work for vaginas and vulvas. If it's got petals and glitter and bits of, I don't know, herby stuff in it, my kids love it. And I'm like, no, don't do that. Get it out of my bath. They don't have those. Really bad. Vaginas are self-cleaning, okay? They're like those posh ovens. You don't have to do anything. They sort themselves out. In addition, if you start using the shower to douche because you think, oh, there's a bit of a niff, it doesn't feel quite right, I'm going to get the shower. What you actually do is you dislodge the good bugs, the lactobacilli that we need, and you allow the overgrowth of the not so good bugs like trichomonas, like vaginosis, that do cause the odor. So you get a vicious circle going on here. So leave your vagina alone, let it sort itself out. In terms of washing vulval area, warm water is perfectly adequate. If you feel you need anything a bit more, an eczema type wash, such as emulsifying ointment, Cetraban, Hydromol, whatever you can buy easily and inexpensively from your chemist. Don't get rubbing it dry with the towel around your vulval area. It's delicate tissue, particularly when estrogen is low. We need to love it. Patch dry. If you want to do anything else, a cool hairdryer, not a warm hairdryer, just a cool hairdryer can help. You can then use an emollient over the hair-bearing tissue. So any bit of your vulva that looks like skin, use an emollient on it if it's feeling dry. If it's tissue that looks like the inside of your lip, then you can get vaginal moisturizers for that. We all love the Yes, Yes, Yes brand. No additives, organic. They're very good at sending out samples, so I'd recommend those. So that can be used whenever you feel that you need it to look after your vagina. Those are the changes again. Okay, so this was the slide that you can get on the recording, obviously, of things that you might notice that are going on that you need to talk to a suitably qualified medical professional. And then genitourinary syndrome of the menopause. So what happens with that? What is going on? So it used to be called vaginal atrophy. In 2014, the name was changed, because vaginal atrophy sounds old and wrinkly and horrible, doesn't it? And we've got enough to deal with when we're having flushes and anxiety and joint aches to be told we've got vaginal atrophy. And also because actually this lack of estrogen syndrome or the lowering of estrogen affects more than vaginas, it affects vulvas, it affects bladders as well. So the terminology was changed back in 2014. Symptoms may well start years after the last period. So I think some women don't realize what it is because they're, late 60s, 70, even older and are getting symptoms. And I would particularly say here, think of your mums, think of your grandmas, your aunts, particularly if they're in a nursing home and they've got memory issues. If they suddenly start getting distressed, if they are suddenly looking uncomfortable, if they're being treated all the while for urinary tract infections, make sure someone thinks to look at their estrogen status, because a very simple thing like not replacing, but treating with topical estrogen can make all of that go away. So symptoms may also occur when we're breastfeeding, because that's another low estrogen state, and they can also start in the perimenopause. So it can happen anytime. People who are being treated for cancer, breast cancer, particularly those that are treated with aromatase inhibitors, can get extremely severe low estrogen problems, so genitourinary syndrome of the menopause. The woman to listen to about this is the very fabulous Dr. Alison Macbeth that talks about this, but there's virtually no one that can't use topical estrogen, and there's absolutely no one that can't use the other non-hormonal products to help with this. So what are the things we're getting? We're getting loss of vaginal elasticity and moisture. We're losing collagen. We're losing elastin. We're also getting a change in the acidity of our vaginas. Our vaginas need to be acid like our stomach is acid. The reason we want it to be acid is it keeps the bad guys away and keeps everything nice and safe. We don't want this to be a portal for infection. We grow babies up there, you know, it's important. But when we lose our estrogen, we start to lose the acidity, and our vaginal biome changes, and so we can be more prone to vaginal and bladder infections. So again, if we are treating the tissue with estrogen, we allow our normal vaginal biome to recolonize and be better. We get loss of labial tissue and tissue dryness, as I've already said, loss of bladder stability, increased prominence of the urethral orifice. So I don't know if I should go back to the previous picture. I shall show you on the golden thing. The little urethral orifice, which is the hole there, just between the vagina and the clitoris, just there, that can become more prominent. So it can be more easily irritated, which means that we feel we need to go to the loo more. The other thing that can happen is we can actually get vaginal shortening, so that if we're, because of loss of tissue elasticity and so on, so that can cause problems with intercourse as well. And I do mention a little gadget that can be very helpful with that later on in the talk. Right, next slide. So non-hormonal help for our genitourinary syndrome of the menopause. I've already mentioned the Yes, Yes, Yes products. So there's the vaginal moisturizer that comes in a white box. And then there's two vaginal lubricants. There's a water-based and there's an oil-based. So the oil-based shouldn't be used if you're relying on condoms for contraception, because they degrade the condoms, but they're very useful otherwise. And there's something that gets talked about called the slip and slide method, which I hadn't heard about until, actually, I heard about it at an event I did for with Meera last summer, which is absolute genius. One's oil-based, one's water-based. You put one on you put one on your partner or your gadget, and they slide. Frictionless. It's, yeah, genius. Yes, Yes, Yes are also really good at sending out samples. So if you want to try their products, you can email them and they'll send you a whole load of sachets so you see which ones you like. They've got different lubricants for all sorts of things as well. So depending on which orifice you like to use for your sexual activities, they've got something for everybody. So there's that. Other non-hormonal things that we can do, there is an evidence base. So we've got trial data that shows that using hyaluronic acid vaginally can help to improve the elasticity and moisture content of the tissue. So if you're like me, you've got it, you put it on your face hoping it'll get the wrinkles gone. It definitely works in your vagina as well. And you can buy this brand that I've put the picture up here is HyaloFem. You can buy it online. It's about £7 or £8. So you can use that. Absolutely no hormones in it at all if someone wants to go completely hormone free, and it's something you can get without a prescription, so really easy. The O-Nut is this little gadget if you've got vaginal shortening. So these are 4 separate bendy rings, and you pop them on a penis or a gadget so that it can't go so far in, but the owner of said penis still gets the stimulation, and you can use as many of those rings as you need. These again you can buy online. So that's my other top tip today. Right, so when we use estrogen around our vulval area, it is not HRT. It is local hormone treatment. If we use the standard estrogen products for vaginas, and we use them in the recognized dose for a year that is equivalent to taking one HRT tablet for the whole year. So it's not absorbed to the whole body. It's not HRT. Unfortunately, when you get the product, the insert that you get is an HRT insert. So it talks about clot risk, breast cancer risk, all sorts of things. Completely ignore it. It's just the system. It's the way the MHRA works. Because it's got estrogen in it, it has to have all that detail on it. It's safe for virtually every woman, including those actively having treatment for breast cancer. If you are in that situation, I would highly recommend listening to some of Dr. Alison Macbeth's recordings that she's done on this topic. I haven't really got time to go into it. There's some estrogen products that are better for women being treated for breast cancer. Basically, Invagis and E-string are, well, Invagis is a very good one for those women to use specifically. But really, the take-home message is that unless you've got an active estrogen positive vaginal tumour, you can use estrogen topically. So there's loads of different products. The most commonly known ones, really, the vaginal estrogen tablets. Vagifem and Vagirux are basically exactly the same things, but with different delivery systems. The Vagifem gives you an applicator for every single tablet. The Vagirux gives you a couple of applicators in a pack, and you put your own tablet in. These are easy to use. Typically use a loading dose of 1 every night for 2 weeks, and then you reduce it to between 2 and 4 times a week in order to control your symptoms. If you've got really, really, really bad vaginal dryness, using these applicators vaginally is not nice. It's going to be sore. So I think particularly in that circumstance, using something like the Invagis is better. That's a vegetable fat pessary, little bullet. You pop this inside, then it gives you kind of a double action. As it melts with your body temperature, you get the lubrication of the vegetable fat, and you're also getting the estrogen in there. The reason that this is particularly good for breast cancer ladies that are using aromatase inhibitors, it's not estradiol, it's estriol, which cannot be converted to the estrogen that causes problems. So anyway, that's just perhaps a bit too much information. The other one that's on this slide is Gina, which you can buy over the counter. Well, you can buy from a pharmacist. Personally, I don't think any woman should have to pay £29 for their vaginal estrogens. You should be able to get it on prescription. And also, personally, I'd rather that other causes of any problems were checked before you're using them. But it is there as an option if you're confident that that's what your problem is. The Invagis is the little bullet thing I've just shown you, and there's also a Blissful gel, which comes with an applicator. I think feedback has been that some people find that quite messy as it's the gel, but it suits some people, and it's ultra low dose as well. Now, E-strings, I love an E-string, me. They're not in, can't get them for love nor money at the moment, which is very sad. These are flexible, bendy rings. Can you see that? If anyone used a diaphragm as contraception, you will see they're super bendy. They contain estrogen, and it's released over 3 months. So for people who don't want the faff of inserting something 2 or 3 times a week, or for someone who's perhaps got really nasty arthritic fingers, dexterity problems, just can't do that all the while. You can have one of these, you put it in yourself, or a practice nurse can put it in for you, or a GP, whoever, and it's changed in every 3 months. I've put up these 2 diagrams. They're from Pfizer, who make this E-string, of how to put it in and how it sits. So you squeeze it together to insert it. When it's inside, it opens up and it just sits there. You can't feel it. I'm speaking from experience. I've got one in situ at the moment and I don't know it's there. Really handy. There's also a cream called a vesting cream that comes with an applicator. So you use the cream internally. That's really useful because sometimes I get ladies they'll use whatever vaginal product they want to use, and then I will give them this cream to use on the vulval tissue if they've got really bad problems. So we can use both So that's another quite nice product to use. There's another group of drugs that we can use for vaginal symptoms, also very handy for women who are on aromatase inhibitors for treatment of breast cancer. These are precursors. They're DHEA analogues. It's a precursor of our sex hormones. So our body can convert this drug, Intrarosa, so progesterone, into estrogen and testosterone in our vaginal tissue. Problem with them on the NHS is that they're not on every formulary in every area. It's a bit of a postcode lottery. They're not mega expensive to buy privately, but for some women, they offer a good option, and they're particularly good for people on aromatase inhibitors, because the aromatase inhibitor stops the conversion to the estrogen that those ladies don't want, but it allows the precursor hormones that help with the tissue. So it's just another weapon in our arsenal, isn't it? Okay, so I feel like
and then by the same token, they're saying you don't put a wash, you don't need to wash it, you don't need to interfere with the biome.
It's
and
fine
then on the other hand, go and stick this thing in there if it's getting dry.
No, it's different. What we're saying is, sorry, was that? What I'm saying is, don't use showers and things with additives and deodorizers in vaginally, because they irritate
I
the
see.
tissue.
Sorry. Yeah.
But the vaginal estrogen, this is body identical estrogen products that are what we've had before that we've stopped having. So it's a very different thing. So what I'm saying not to do is to, even KY jelly, which is the things that people typically, women have used, haven't they, as a moisturizer, vaginal lubricant, that actually has got lots of things in that cause further drying of vaginal tissue that can irritate. The Durex things that you see that have got the tingly effect, you see them in the supermarkets. If it says it's going to give you a tingle, it's irritating the tissue. Don't use it. You want to use the organic, very plain stuff, or an estrogen product. Has that sort of clarified a bit? Yeah. Okay, so my take-home message is, know what you look like, know what you feel like, get used to looking at it. Partners can be really helpful. They probably see it more than you anyway. So report any changes. Do speak to your GP, your practice nurse, about any changes. Remember that bladders need estrogen as well. So any change in bladder symptoms, irritability of the bladder, that can also be because of low estrogen. So think about it, go and discuss it with your healthcare professional. Keep it simple for vulval and vaginal care. Remember that vaginas are self-cleaning. Moisturize both as needed. Topical estrogens are safe for almost everyone. And also, no one with vaginal dryness should be penetrated by anything without lubrication or estrogen treatment. I do general practice work as well. I work in the out of hours. And about a month ago, I saw this lady who'd had to go for a colposcopy, which is a treatment for an abnormal smear. And she hadn't had a period for ages. She hadn't been able to have sex for 5 or 6 years, she said. And she went for this colposcopy, and the speculum was put in, and she said she thought it was going to tear her apart. They then did the procedure. They then took the speculum out, and the gynecologist decided that they were going to do an internal examination to have a good old feel around to make sure there was no ovarian lumps as well. And at no point had this woman had any discussion about vaginal lubricants, vaginal estrogen topical treatment. And I just feel really passionately that that is criminal. It should not be allowed. So if you're going for your smear and you know it's dry, go and talk to someone. If you don't want to use vaginal estrogens, there are lubricants and non-hormonal options if that's your preference. Personally, I would use vaginal topical treatment to do it. Nobody should be having to put up with this in this day and age. So spread the word to everybody. you know, you should, if you want a sex life, you should be able to have it. You should not be feeling so uncomfortable that you can't go out and exercise and be on your bicycle, or not be able to do it because your bladder's so unstable, you're having to wear great big pads. It's not okay. This is easy to treat. It's not dangerous. It doesn't cause blood clots. It doesn't cause cancer. We just need to know what the options there are there for us, and to be guided to choose what works for us. So, right, that's my little spouty offy bit. Some resources. There's Jane Lewis's book, Me and My Menopausal Vagina, which is excellent. Also, Diane Danzebrink and her team have come up. This booklet has got a section on GUSM in it. There is a QR code that you can do that will take you to a downloadable version of that book. And that's an excellent resource. And then I've got, yeah, any questions? And the last slide is that's me. If you can find me on Meera's courses, and also I've got a virtual clinic that I run as well, with the option for face-to-face if people need it in Stafford or Solihull. So I'm going to throw it open to any questions or chat now.
Thank you, Jacqueline. That was absolutely brilliant. We have got some questions actually that have come up in the chat, which has been great. I'm just going to go through all of those, and then if anybody has any questions, then of course, as I said, just you know, unmute yourselves and then ask. Can I just say though that I actually, the reason, again, going back, the reason I did this talk was because I really didn't understand. I didn't know what was happening. I exercise a lot. I've got pretty good pelvic floor, muscles. I am fairly strong. I do all the things I should be doing, you know, all of that. But I really didn't know that my vulva and my vagina and that needed estrogen at all, and I didn't realize the help that I needed. And it was only when I went for an examination that you know, I kind of knew it was happening, it was changing. It was almost like everything was sort of dropping, or it was shrinking. I don't know whether the lips were sort of shrinking and everything was coming down. I just didn't, but I could feel that it was just a very different place. Also wearing pants or wearing leggings that I live in just became a little bit more uncomfortable. And exactly that feeling, actually, Jacqueline, that you mentioned, where you're standing there and you're going, oh, you go, oh. It's kind of like you can feel it, and you're like, you should not be feeling anything down there because you haven't felt anything. So all of those things were just things that were going on, and it was getting very uncomfortable. You know, sex was painful. It just wasn't something that was on the register. Please, no, thank you. You know, all of that was just happening. And I just, as I said, we don't talk about it enough. We've got some amazing questions, but I actually personally have found that the hyaluronic acid, absolute game changer for me. And actually, you know, the estrogen, the localized estrogen again as well, real game changer. I do struggle with the pessary. I find that I seem to get, I'm one of those people, I obviously have to be, don't I? Be really awkward and difficult. I get a bit of a discharge. It kind of is very uncomfortable. But I'm fine with applying it locally. That seems to just do the perfect trick, and I'm absolutely fine. But we've got some really amazing questions that if I can just run through, if that's okay. And I've got loads of messages coming up now as well, so I'm probably going to go through those questions. But I'm going to start with the one that I don't want to lose it on here. It just says, if someone has an allergic reaction to Avestin, there was 2 questions on Avestin actually. So this was one, and they needed medication in A&E. Subsequently Vagifem, and had a reaction on her lower abdomen. What does she do now? Because the GP seems to not have a clue. Are these common reactions? So allergic reaction to Avestin and then Vagifem.
Yes, I would have to get up. I've got a spreadsheet of all of the additives of all of the vaginal estrogen products. And the ones that have got least additives in is Invagis and Blissel. So if I would have to have I can't remember it off the top of my head. It's one of those awful big things. But yeah, different products have different additives. So if you've had nasty reactions to one, the thing to do is see there's lanolin in some of them. There isn't lanolin in Invagis, it's vegetable fat, for example. So it doesn't necessarily mean that you can't use either. It sounds like quite a scary allergic reaction if
It
it
does,
landed
doesn't
you in
it?
A&E. So
That's
I would
awful.
say that I would probably it's not going to help your bladder function, but the hyaluronic acid would be a
Yeah.
thing to try. But again, check the additives in the Hyalofem because that's got additives in it, all of it. So
Yeah.
yeah. So
Okay.
in terms of GP knowledge, it might be a little bit tricky unless you've got a GP that has got access to a spreadsheet like the one I have.
No. So, I mean, really going to somebody who's a specialist like yourself is going to be the key, really, isn't it? I just find I'm saying that a lot, is that actually, you know, GPs are fantastic. They do an absolutely amazing job, but they don't always have a specialization in menopause, or particularly in sort of kind of.
No, absolutely. I mean, if you were going to try anything else, it's worth thinking about Invagis or Blisscell because they have less additives in, I would say.
Okay. Perfect, thank you. And I think the other one on investing was about the breast cancer patients. And I think we have answered this, but I'm just going to say it again. It was, you know, can breast cancer patients use Avestin on the vulva? And it was, I think that was the question, but I think you've answered that earlier on, but just to kind of reiterate that.
If it's someone who's had breast cancer and is being treated with tamoxifen, then that's absolutely fine because tamoxifen stops conversion, blocks estrogen effects on breast tissue. So
Right.
it's fine to use. It'll stop anything that any little minuscule amount that did get absorbed
Yeah.
would get blocked on breast tissue, so it would be fine. But if it was someone on an aromatase inhibitor, then I wouldn't necessarily be giving Ovestin. I'd be looking, there's other things that I would use first.
Yeah. Okay. Jacqueline, would you be able to stop sharing your slide, please? Because everyone wants to see you.
You sure? How do I do that?
So just go up to your stop sharing, I think.
Stop share. Okay.
There
Okay.
you go. That's better.
Oh,
Perfect. There we go. I can actually then see the
you can
questions
see
on the
everybody.
slide. Right.
Okay.
There was one that, so another question. What impact does constantly shaving have on our labia? Or I think you answered this as well again. But
I
just
mean,
to,
it's not only the vulval tissue that gets dry with lack of estrogen, it's the skin bit as well. It's the mons pubis. So you're going to get more eczema type reactions. You might get a flare if you've got psoriasis elsewhere. So the tissue is generally more delicate. So you might get away with some shaving, but just be very aware, and everyone's different, I think.
yeah.
I certainly, as a perimenopausal or menopausal woman, would not be going for the whole Brazilian or Hollywood waxing thing because that's just asking for trouble.
And it's interesting, isn't it? Because you get told, well, I used to, whenever I used to go for my waxing, it was like, oh, no, get it. It's clean. You've got to be clean. Take it all off. It's all clean. And you're like, I've had it done a couple of times. I'm like, oh God, I'm not getting that done again. It's horrible. Like literally, we feel like everything's being pulled off. But yeah, you get told it's clean, it's dirty to have hair there. And
That
actually, again, this is what we need to stop, because
the
actually it
hair
has.
is there for a reason, isn't it? And I think, I mean, yeah, I mean, I can sit on my high horse and say, oh no, I mean, one of my daughters that doesn't shave anything anywhere. She goes, it's conforming to male stereotypes, and I'm not doing it. No, I'm not that person. I can't wear my bikini, and I need to have a little bit of a trim.
No.
But I do it care, you know, I'm not wearing those tiny little triangles. No one needs
No.
to see me with those anyway. So I think just be aware of what the problems might be. And then if it's really important to you, you've got to weigh it up and see what
Yeah,
you can do. And
exactly.
my concern is always full awareness, then we all take our own choices, don't we?
Decisions.
Yeah, but
Absolutely.
it's not dirty to have hair there. We might not
No,
like the look of it, but it ain't
no,
dirty.
no, that's exactly it. And I think again, what we always talk about is choice, isn't it? And I think that's the thing.
Yeah,
Once you're informed,
absolutely.
you can make an educated and informed choice, and that's crucial. Another question was just again going back over the products. So I know Gina is available via,
Pharmacists.
pharmacist. I have to say I tried that first and I thought, right, I'm going to go down this route because I don't want to go to the doctor always, avoid kind of, don't know what I'm going to be told. But I saw the form that I had to fill in and I was like, okay, no, I'm going to go to the doctor. I think I'm not going to go to it just completely, I'm terrible with forms anyway, like, anything to do with a form, terrible. And then but all the others that you mentioned, do we have to go to the GP? And again, I think you've covered this, but just to recap.
Yes, you need a prescription for everything other than Gina.
Okay.
They sell it for about it's about £30, isn't it, for 24 tablets? So you can get it if if it's just really difficult. And let's face it, it's cheaper than a private menopause consultation, isn't it? So if that's working, all I would say as a caution, I'm an old GP, I'm 60 next week. I mean, how scary is that? So I've been at it a long time. I was taught that you examine everything. So if people have got symptoms, I want to know that it's not anything dangerous. The fact of the matter is that for a lot of women, this is just going to be low estrogen. And as long as I think the person in front of me, because I do virtual consultations, if they're sensible, and I'll say, look, have a look, make sure there's no whiteness, no redness, no breaks in the tissue. It's just that it's very dry. You're not seeing any ulcers or anything. Then you can go and get that, you don't need to have, but just it's again, be aware of what the pitfalls are, and then you can make decisions.
Yeah, I mean, I did choose in the end not to go to the GP, and I chose to go to a menopause a GP that specialized in menopause, just simply because, again, I just I did pay privately for it, and it's not an option that everybody has. But for me, it was something that was a priority for me. I just needed my peace of mind. I needed to know what I was doing. I needed to kind of, so yeah, it isn't, it isn't an option for everybody. But I think if I had been armed with all the knowledge that I've got now and this talk that we're having, and again, what prompted me was the talk that we did in the summer, that was, we had the conference in the summer that I held, and actually all the experts there were talking about were they talking about the E-string? Yeah, the E-string, and they were talking about, and we would, it was just an absolute eye-opener for me. That's the one.
But I think as well, I mean, it's the sort of thing that gets my goat, really, and I'm getting worse at this the older that I get. And I suppose having the sort of offspring that I do, who are all quite feisty, doesn't help.
Yeah.
but it's all other people's values.
Yeah.
Being put on, and it's kind of not okay.
No.
So all this stuff that's been sold, and I hate that Boots do this, because I used to think Boots was a really friendly, people-friendly thing, but they're selling all of these deodorizer things and trying to tell us that we're not supposed to smell like we smell. No one goes around selling bloody deodorizers for willies, do they? I mean, there's no pressure, is there? I mean, I think with the younger lads, there is a little bit more pressure to be groomed and tweaked and shaved and everything, but a lot of this stuff, they're selling it to make money, and menopause has become big business. They're selling menopause everything, and I hate it, because this is simple. The first port of call for every woman is stop washing with the scented stuff. Use your water, use your moisturizers. I mean, coconut oil can be used as well. This doesn't have to be expensive.
No.
So just common sense, not letting people tell you this is dirty, you shouldn't smell like this, you've got to have this clever deodorizer smelly thing and use this bath bomb. Stop all of that. Don't listen to it. They're marketing. Anyway, I'm ranting. I'll shut up.
No, you're not. I mean, we could literally go on. I would quite happily get my soapbox and stand up there, because, those of us who've been doing this for a while, could see this coming. You could literally see this coming. The minute people cotton on to the fact, manufacturers and marketing people cotton on to the fact that actually they've got a whole population out there of women who potentially have the spending power too, because we're of that generation, of that age, you suddenly market everything. And I think there are supermarkets and pharmacies that are going to have aisles dedicated to menopause. I mean, honestly, I know. Yes, Alina, I can hear you. Yeah. Literally, you need to avoid, but the only way they'll stop doing it is if we stop buying it. But sadly,
it's like the shampoo, isn't it, as well?
Oh, God.
But actually, simple measures that are
Yes.
inexpensive may be all that you need. You may not need to go and see a private menopause specialist.
No.
I'm doing myself out of business here. Oh, come and
No, no,
pay.
no, no, but it's true.
But actually, if we do the simple things we know about them, you know, we get online, we go to Yes, 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 we get our samples and we have a try, then we seek help if we need it.
Yeah. Yeah, absolutely. But it's the same with everything with menopause as well. We digress slightly, but you know, even things like supplements and food and all of those types of things, you've just got to be really mindful about what you're doing. Why are you taking something? Why are you using something? You know, and it's just, again, we can do a whole different program on this. A workshop on this. One more thing was about supply of estrogen. Is what's happening with that? I think that was Alison asking.
Yeah, Diane Dansbrink's is my source of information on all of these things, and she's been in touch with Pfizer, and they just said that they keep saying it might be available the end of next month. I have no idea why there's a problem with it. I used to use it when elder people that choose not to have surgery for prolapses have rings put in, and we would, as a matter of course, I would fit them with one of these rings at the same time, because otherwise the ring is irritating dry tissue. So it's a really, really good product that's useful for lots of people. And there never used to be an issue with it. And I don't know why they've suddenly, I have no idea. No idea why. And they keep promising it the end of next month, and it doesn't come. So
that is frustrating. Supply issues with HRT and other female products. Yeah, I know they are infuriating. It does make you sometimes think, is it just because we're women and it's just, well, they can do without, we'll have to put effort and money towards something else.
Well, the UK is prescribing more HRT than any other country in Europe.
Yes, I saw that, the percentage in comparison to America,
Huge.
to the
So I know
States as
that,
well.
well, Bezins have built a new factory in Spain to make more estrogel and stuff. So, and Nutrigestan, and there's more products coming online. There's more micronized progesterone products coming online with different brand names. So hopefully it will. Unfortunately, testosterone tubes have been discontinued. Which is, yeah.
Yeah. Have you still got yours? Are you guarding it with
It's under a very big padlock, but it's going to run out soon. Yeah, so we'll all be on Testigel, but there are some new testosterone products coming. So yes, it is extremely frustrating. As I say, I use Diane for my source of information because she's up to date and she puts effort in, and she always puts it out on her social media.
Yeah, she does. Okay, just another couple of questions, because I can, you know, we're past our time, and I know everybody's taken a lot of time out to come and be with us today, but I'm very, very grateful. I think Shanaz asked about the insertion. Does insertion interfere with the biome? I think she asked that question, and I think we've answered that one.
Yeah, it shouldn't actually, because what it should do is it puts the acidity back so that the biome can be improved. So no, it doesn't.
So it actually, so again, it's one of those things, right? So there's questions you ask where you just think, oh, it's going to be an egg, but it's not. So should be available in it. Okay. Painful bladder. Any help or advice? Painful bladder. I'm not sure. I'm not sure in what context, or I don't know whether you can answer that, or do you need more information?
Bladder muscle has estrogen receptors in it. So a low estrogen state can mean that you get more bladder spasm and that sort of thing. So absolutely it can help with it. There are other conditions and other medications though, like drugs like solifenacin, which is drugs that are used for incontinence. So it's absolutely something to talk to a healthcare professional about. But vaginal estrogen is certainly one of the tools that I would be looking at to use to help with that.
Perfect. We have got Julia. Did you want to ask the question? Can you unmute yourself, and then you just need to, just unmute yourself so we can hear you. Or do I need to unmute you? I can't seem to unmute you. You need to do it yourself. Or if you want to type the question, you can.
If you click at the top of the picture of yourself, that's it.
I think I've done.
Oh, there you go.
Hi.
Hi,
hello.
It's
Hello.
Linda asked about, I've got painful bladder syndrome. It's been so bad, I've been wanting to end my life. It's been that bad.
Oh, I'm sorry. God, that's
I've
awful.
had bladder installations, seen Dr. Zoe Hodson, who helped me out in the first instance, but I just can't seem to make any progress. I've stopped the installations, taking amitriptyline, and I'm still using the vaginal estrogen, but I was wondering if anyone had any other tips that I just don't know about.
The urogynecologists down in Birmingham have do different strategies for bladder pain, including Botox. So see a urogynecologist to try and help with that may be a thing. I mean, I only ever have anything like that done by someone that absolutely knows what they're doing, because it could go very badly wrong if they don't. So, but yeah, there are different strategies, and vaginal estrogen's one of them. But if it hasn't made a difference, then I think obtaining a referral to a urogynecologist, which is someone that specialises in women's bladder problems.
Yeah, believe it or not, I've actually seen one, and I was supposed to get like a 3-month review, but then there's all these 500,000 women who couldn't see a gynecologist, so they never got back in touch with me. And I spoke to my GP last week. It's just a nightmare. Women's health is a nightmare.
I'm so sorry to hear that. It just absolutely shouldn't be happening. It's awful. I think all you can do is try and get another referral, isn't it?
Yeah.
And
I will, thank you. Yeah.
I'm sorry, I can't offer any other.
No, Julia, I hope you can just keep persevering, keep badgering them, really, because it's that thing of, just don't stop, because you deserve to have the treatment, you deserve to be seen.
I'll try.
And heard. So please just keep going with it. And I, wish there was so much more that we can do, but I think you'll find that there are so many people on this call who just feel like they were not heard, they were not seen. It's getting better, but it's not where it should be. And I know Jacqueline, myself, and there are many of us who are literally doing everything we can to try and make sure we change women's health. And a lot of it, we do we do for nothing, in the sense we just are sitting there fighting that corner for you all. But it is like I said, your story, and it's probably not unique, but for you it's really difficult, and I'm really sorry you're going through that. But please do keep fighting for it, because you deserve it. So don't give up, because that's
thank you.
half the thing. Oh, she might go away and not come back, but don't do that. Please keep going, because you deserve that. You deserve to be seen and heard. Catherine, you've got your hand up.
Yeah, I mean, I was told by the doctor that I have a issue between my brain and the neck of my bladder.
Oh, I saw that.
It's telling me, that I need to go to the toilet, even if I'm literally sitting on the toilet. But it comes and goes. They put me on the solivacine, whatever that is, but they told me that was a short-term thing. So it happened once. You kind of thought, oh, well, that's it. Then it happened again, and talked to Aileen, and she said maybe getting the vaginal estrogen. But what would be the best one for me?
Whichever one suited you best is the short answer, really. So it would be about having a look at the different products, seeing which one you felt most comfortable with using. And you could, any of them, really. What I would say about the vaginal estrogens is that I've seen many women who need to use more than it says is the maintenance dose. So it says, like, the maintenance dose is to use whichever product twice a week once you're maintaining. I've got many ladies using it every other day, or even more than that if they need it, because it's so incredibly safe. You find the product that you like to use, that suits you, and you use the amount of it that sorts out your problem.
I mean, it's frustrating, because I've told the doctor about this, and I've been several times, and she's actually the menopause specialist, and just said, no, there's nothing we can do. So now I know this.
Have you got no vaginal estrogen product at all?
No.
I mean, you could always do your own trial for 30 quid. You can go and get some Gina, and you use it every day for 2 weeks. Keep a bladder diary, so see how it goes, and then give them the evidence. It's not expensive for the NHS to prescribe, so I don't really understand why they won't give you a trial of it. It's a bit confusing.
Okay, thank you.
Okay, so I think we are going to call it a day, actually. Thank you so much, everyone, for joining. You have Jacqueline's details. If you have registered and you are happy for us to send you out some more information, we can send you Jacqueline's details out again and how you can get in touch with her. Also send you out my details, how you can get in touch with me. And also we're doing a webinar conference in June, getting everybody together, lots of amazing speakers together. Jacqueline can't be there for this one, but she is always first on my list when I'm asking people. But it's an amazing
I'm going to be
day.
walking the Camino de Santiago that week, actually, with some girlfriends. So this
as
is
you
part of
do.
my, I have all my products with me, but I'm really, they're really good days, actually, Meera's days. So I'm glad I can't be there.
Thank you so much. But ladies, have a wonderful, wonderful evening. We hope you found this useful. If you want to give us some feedback, please make sure you email back and just let us know, because both of us would love to know how it was. If you'd like us to talk about something else, we can also do that too. But have a wonderful evening. Take care, and I will speak to you hopefully and see you all soon. Bye-bye.
Okay, bye
Thank you
everyone.
so much. Thank you
Happy
so
Sunday
much. Bye-bye,
night.
both of you.
Bye-bye.
Thank you.
Bye.